Assalamu alaikum. The impact of minimally invasive root canal treatment on healing outcomes in a randomized clinical trial. This article was published by Kwon and colleagues in the Scientific Report Journal in 2025, which aimed to assess the short-term post-operative pain and the long-term success rates of two distinct root canal treatment approaches over a follow-up period of 2 years. They compared a conventional treatment protocol, which used pro-taper gold system, with a continuous wave condensation technique, and the minimally invasive treatment protocol, which utilized true anatomy files and sealer-based obturation. The inclusion criteria included patients that were 18 or older with mature permanent teeth in need of root canal treatment. Exclusion criteria included teeth that had previously undergone treatment or initiation, teeth with periodontal pockets extending beyond the apical third of the root, recent analgesic use before the treatment, communication difficulties, and root canals that could not be negotiated within 2 mm of the radiographic apex. They included 180 cases in the study, and all the procedures were carried out in a single facility by 3 professors and 7 residents. In the conventional protocol group, the root canal shaping was done by pro-taper gold files, finishing with F2 for curved canals and F3 for straight canals. And the obturation was carried out using continuous wave condensation technique with AH plus sealer. For the other group, the true anatomy system was utilized in the sequence recommended by the manufacturer, which was the orifice modifier, glider file, and prime file. The final shaping instruments were prime shaping file for curved canals and a medium file for straight canals. And a calcium silicate base sealer with a matching gutta percha was used for obturation using vertical compaction technique. So at the initial visit, the patients were instructed to rate their preoperative pain levels on a numerical rating scale, and the quality of the root canal filling was assessed based on 3 criteria, which were sealer extrusion, root canal filling voids, and root canal filling level. And only patients who completed at least 24 months of follow-up were included in the healing outcome analysis. And the healing outcomes were assessed using both strict and loose radiographic success criteria. One being the strict criteria, which was asymptomatic tooth with no apical radiolucency, loose criteria, asymptomatic tooth showing reduction in apical radiolucency size, and failure being a symptomatic tooth with no change or increased periradicular radiolucency. So clinical assessment included the evaluation of pain, swelling, the presence of sinus tract, other symptoms, and overall functionality. So in the end, 180 participants and 125 teeth were analyzed in the final evaluation, and the average follow-up duration was 36 months. The overall success rate of root canal treatment was 84.8% based on the loose criteria, and this conventional protocol group demonstrated a significantly higher success rate of 91.9% compared to 77.8% in the minimal invasive protocol group. The odds ratio that was mentioned is being in the MB group, and the absence of sealer extrusion and the presence of a sinus tract, which significantly increased the risk of failure based on the loose criteria. Coming to the strict criteria, the overall success rate of the treatment was 80%, and similarly the conventional protocol group achieved a success rate of 88.7%, which was significantly greater than the 71.4% observed in the minimally invasive protocol group. And again, the odds ratio was higher for the group being the minimally invasive protocol, and presence of sinus tract, and also being a male participant, which significantly increased the risk of failure based on the strict criteria. Other than that, there was no significant differences between the groups, and they concluded that the reduced canal preparation dimension in the minimally invasive protocol group, rather than the supplementary technique, was likely the reason for the observed differences in success rates. So in the end, clinicians should carefully weigh the benefits of dentin preservation against the need for effective disinfection when selecting endodontic treatment strategies. Thank you.